Welcome to this explainer. Okay, we're diving straight into a really fascinating question today: the true economics of preventative healthcare. We're going to look at what the data actually tells us about a concept that is literally the foundation of public health and corporate wellness. You know that old saying, right? An ounce of prevention is worth a pound of cure. Well, we're putting that to the test. Does keeping people healthy actually shrink the medical bill? Or is the reality just a whole lot more complex than we've all been led to believe? Section 1: The Promise of Prevention. So, we have to start with the universally accepted promise that preventing disease is hands down a society's best financial investment. And honestly, on the surface, it's undeniably compelling. When economists use something called the value of statistical life, which basically just means assigning a dollar amount to the economic impact of saving a human life, we see massive, and I mean massive returns. Take vaccines between 2021 and 2030, for example. Every single dollar invested gives you an incredible $52 return when you factor in the value society places on saving a life. I mean, compare a 52 to 1 return to the stock market. It's just a staggering statistic. Section 2: The upstream river analogy. To really understand how we tackle health to get those kinds of outcomes, let's break down prevention using a brilliant analogy from the Institute for Work and Health. Imagine a local mayor and a swimming hole. Let's say citizens are suddenly developing these persistent rashes after swimming in the local river. We can tackle this in 3 steps. Step 1 is primary prevention. The mayor steps in and completely stops the upstream chemical spill that's causing the rash in the first place. Step 2, that's secondary prevention. Lifeguards are actively checking swimmers for early signs of the rash so it can be treated super quickly. And step 3 is tertiary prevention, creating support groups and management plans for people who already have lasting rashes just to soften the long-term impact. The big takeaway from prevention experts: the further upstream you are, the more effective your intervention is going to be. Section 3: Surprising cost reality. But here's where the story takes a really surprising turn. It kind of challenges everything we thought we knew about the healthcare bottom line. A report from Health Affairs reveals that things like medications, diet programs, and even cancer screenings usually cost more to run than the money they actually save. Crazy, right? Over 4 decades of cost effectiveness analysis show us that giving out medications for hypertension, or running exercise programs to prevent diabetes, and screening whole populations for cancer, well, it actually adds to overall medical spending rather than shrinking it. Now, the math explains exactly why this happens from a purely statistical perspective. Because cancer actually accounts for a relatively small proportion of all deaths, even highly effective screening procedures only reduce overall all-cause mortality by a tiny 1 to 3%. To put that into perspective, breast cancer screening might reduce all-cause mortality by a maximum of 1.8%, sigmoidoscopy about 1.2%, and PSA screening by just 0.6%. So financially speaking, you're spending a massive amount of money screening millions and millions of people, which ends up completely diluting those hard medical savings. Section 4: A false dichotomy. So, to solve this mystery of why prevention costs more but remains so incredibly important, we really have to look at how our very definition of disease has evolved over the past century. We are no longer just curing fast-acting acute diseases. Instead, we're managing slow-burning chronic conditions over a much longer lifespan. Think about it. In the past, acute infectious diseases had a rapid onset and a very short timeline. You either recovered or you didn't. Today, our major health burdens are chronic conditions like cardiovascular disease and diabetes. These are things that develop slowly and can linger for decades. Which brings us to a crucial point. Drawing a hard line between prevention and treatment is honestly a false dichotomy in a world dominated by chronic illnesses. You can't just apply a single intervention once and call it a day. Almost all interventions today are this complex blend of both prevention and treatment. The true goal isn't just eradication anymore. It's managing these conditions to push down their impact on an individual's quality of life as they age. Section 5: Uncovering the hidden ROI. Okay, so if the clinical savings aren't always there on paper for these broad public programs, we need to look a little closer at the workplace to uncover what I call the hidden return on investment. A Rand Corporation study of a Fortune 100 employer found that a massive 86% of an employer's hard medical savings comes directly from disease management. That yields about $3.80 for every dollar invested. Not bad. But on the flip side, the lifestyle management component, things like gym incentives or diet support, that only generated 14% of the savings, bringing in just 50 cents for every dollar spent. Now, when we contrast those strict clinical claim reductions against the unmeasured, invisible productivity boosts we get from having healthier people, a totally new picture emerges. Because let's be real, if you just look at that 50 cents on the dollar return for lifestyle management, you might be really tempted to just cut those programs entirely. But honestly, that would be a huge mistake. Sure, lifestyle management might only return 50 cents on the dollar in strict medical savings, but it generates this amazing employee positivity factor. Through endorphins and physical wellness, it boosts sales, improves the customer experience, and supercharges teamwork. Think about it. When people exercise and feel good, they don't just cost less at the doctor. They bring so much more energy and innovation to their daily lives. And that right there is a massive invisible ROI that standard clinical spreadsheets almost always miss completely. Section 6, Redefining Healthcare Value. So this really brings us to a much-needed redefinition of how we calculate the true value of healthcare interventions. Instead of just tallying up hospital bills, we have to start measuring the value of a statistical life, the reduction in lost wages, and honestly, the moral imperative of keeping our communities thriving. A 1 to 3% reduction in all-cause mortality from cancer screenings might seem like a really small number financially, but in the world of public health, that translates to thousands of actual human lives saved and families kept whole. I want to leave you with a final, kind of provocative thought today. If prevention buys us a longer, more vibrant life, even if it doesn't actually save cold hard cash, isn't that an investment still worth making? We really have to stop viewing health strictly as a cost-cutting measure and realize that sometimes health is exactly the wealth we should be spending our money on. Thank you so much for diving into the data with me on this explainer. I really hope this completely changes how you view the economics of your own well-being.